I'd like to welcome everybody to the event tonight. A little bit of background on how it started. Back in February, at the beginning of the year, we did what I called the show and tell event, where we brought in legislators from across the Commonwealth in, and we had different people from IBM, other FBI representatives and things like that, and then we kind of had this gap till about last month. And how it got started was I had 1 week where I got a call from Mayor Newstrom in Charleroi, said, "Bud, we just can't handle this anymore. We're overwhelmed in Charleroi." The same week I got a call from Mayor Gerald Jackson over in Melbourne, and same situation. But what really sealed the deal was the 2 calls that I got from 2 fathers that week begging for help because they were about to lose their sons if they didn't get them into treatment. So at that point we kind of stepped back and we took a look at it, and I'm a firm believer that we are not going to fix this from Harrisburg, and we're not going to fix this from Washington, D.C. It's going to take a grassroots effort, and we need to marshal all our different resources in the Valley. Last month, the first one of 3 series that we did was called Treatment, and what we wanted to do was take a look and see what assets we had available within a 25-30 mile radius of the Valley, and also what we wanted to do was invite some recovering addicts. And my one regret from that meeting was we didn't have the video crew there, because those stories were very, very informative. One actually told the story about how he did drugs in the high school as long as he shared the drugs with his teacher. He was okay. He could not buy milk, bread, or gas within a 25-mile radius of his home, but he could get drugs at 3 different places. So that was the first part, was the treatment. This portion tonight is prosecution. And I realized after the EMS hearing there was an awful lot that I didn't know and I wasn't aware of. I didn't realize EMS was under the pressure. They were making the runs, doing the Narcan, not getting paid for it because there was no transportation. So that was very enlightening to me and informative, which kind of led us down the other path. Is okay, what don't we know what these gentlemen that are here tonight are dealing with on a day-to-day basis? So tonight what we want to do is just, again, our events are very informal. There's no prepared notes that I know of with these guys. I just ask them to come and basically share from their local, county, and then Gene from the district attorney's office what we have. It is working, what challenges we have, and what legislation do we need changed in both Harrisburg and DC to help us do this. The last third part of this will be January the 18th, and we want to center on prevention. And I think that's critical for our young people coming through, as well as some of our senior adults. What action can we take locally to do that? We need to marshal and get the word out, as we need to get our churches, nonprofits, and some of those other service organizations involved in this. Right before we came out, I had gotten a call from one of the churches that was actually having their service tonight, but they're going to try to come a little bit later. So with that, what I would like to do is we're going to start local and come up through the county and finish with Gene. So TJ, if you could come up and kind of share from your perspective. I'll let TJ do the introduction. And
oh, just stay there? Good.
There you go. You're good.
Okay. Hi, my name is Tom Wilkinson. I serve as the mayor of the borough of Roscoe, fire chief for Stockdale, and chairman of RESA Regional Police Department. This is my 40th year being involved with the fire department, and 33 with the borough, and I've been with the police department since the day it started. And things have really changed over the 40 years. We always say we're kind of lucky with our small area that we have. It's so quiet that I always make a joke if a drug dealer moves in here they stick out like a sore thumb because it's quiet and you see the activity. So luckily our guys have a chance to crack down on it, but you know, it puts a strain on them because we're a part-time department. And from the fire department angle, I happened to walk into a meeting about 3 weeks ago, and I heard somebody say, well, the fire company does the Narcan, but it doesn't cost them anything. Yeah, it does. It hurts our service area. When the guys have to come out for, you know, these type of calls in the middle of the night. And a lot of times when you're a fireman, you go to be a fireman, you don't want to be an EMT or, you know, in the medical field, but we're getting pushed into it because the ambulance services are so overwhelmed. And, you know, in a small community, you just can't sit there and watch somebody die or whatever. You have to take action to help them out. And you know, we have a hard time with getting money. We're lucky in our area that we actually have people that do fundraisers for us to get hours for the police department. So it'd be nice if our guys were involved in these incidents or whatever, that there would be some money come back to the local to help us out. You know, if I got $10,000, I could put 600 more hours on a year. You know, which would help us probably arrest more people because our guys are going to be out there on the streets more.
What I'd like to do is we'll go through each one of the presentations and we'll do questions and answers afterwards on that. Deputy Ryan and I have crossed paths like 4 times since 2014. And one of the problems that jumped out to me when we were doing the door-to-door, every 5th, 6th house we went to, either that person knew somebody in their family, they knew somebody socially, or somebody they worked with was dealing with opioid addiction. So it kind of heightened that. But Deputy, if you could share with us from your perspective on what you're seeing out there, what challenges, what can we change legislatively?
My name is Ryan McReath. I started in law enforcement when I was 24 years old. I started at the Washington County Sheriff's Office. I got on with the Washington County District Attorney's Drug Task Force in May of 2013. Became a patrolman for RESA Regional in October of 2013. So I have about 5 years in now in the law enforcement profession. And I touch on that years because things have changed so much from when I started working for District Attorney Vitone, doing drug investigations up until now. If you notice in the planning, I ended up getting assigned to the Drug Enforcement Administration for the United States of America, or DEA, based off an arrest that had taken place here at the Dairy Queen up in North Charleroi. I actually crossed paths with Representative Cook while I was actually conducting an investigation in Meadow Avenue in the borough of Charleroi. He actually walked up on me. From an enforcement standpoint, I think there's people call in and, you know, complain about there's a drug dealer in my neighborhood. I think that there's a disconnect where they think that as law enforcement officials we can come in there and just eradicate the nuisance immediately. A solid drug investigation, in my opinion, you know, takes at least 2 to 3 months, depending on, you know, the level of dealer that you're dealing with, or, you know, the type of offender that he/she is. It could take longer, and it takes a lot of resources, not only to ensure the safety of the individuals that are working with you, but for the people that help you get to the point to where you're actually ready to arrest that offender. As far as heroin goes, and heroin investigations, heroin is by far the cheapest narcotic that you can get on the street right now. I've seen it, you know, depending on area. it fluctuates a little bit between here and Washington, which is primarily where I work. I primarily work the Valley, so I work from Bentleyville on down to West Brownsville through Charleroi, out through Findlayville, Orama. And I mean, I've done some work in Washington. It's relatively cheaper in Washington. Of course, there's more quantity. Most of your Valley narcotics comes from the city of Menneson, which is just across the bridge. That's where a lot of it comes from. The actual case that I'm assigned to now, although I can't talk about that very much, that's primarily where, you know, this heroin opioid epidemic is stemming from. Again, the law enforcement side, it takes a lot of time. It takes a lot of resources. It's not something that can be changed relatively quickly. Representative Cook's idea on starting and emphasizing the prevention and the grassroots movement amongst the community, I believe that will be the trigger, the mechanism which helps to eliminate the situation that Washington County finds itself in now.
I think the toughest thing for me as the representative in the 49th is when I'm out talking to people, we are really fighting an uphill battle, and Gene's going to go into it a lot more on the numbers and the statistics. We are doing a lot of things right in Washington County, and Gene's been on the forefront of a lot of that, but we have to engage even more. And we talked probably 2 or 3 weeks ago. You know, I just heard on the news somewhere today, nobody's taken into consideration the economic impact yet on the economy, and it's huge, and it's getting bigger. So I'm really looking forward to Gene sharing with us our successes, and we've had quite a few in Washington County. There's some great programs at the county level, and Gene can kind of give us that and much, much more.
Yeah, my name is Gene Baton. I'm District Attorney in Washington County. I'm going to pick up a little bit on what Deputy McGreath said, because it's very important people understand this. There is no quick solution to this. It took us 20 years to get to the point where we're at right now. This is multifaceted, and it requires an approach from everybody that's involved with it, be it the hospitals, the healthcare community, law enforcement, the courts, probation, parole, the jail. It's going to require work from all of us, and it requires a marriage of public health and public safety, because this is a public health problem. In Washington County last year, we had 106 people die from overdoses, as reported by Coroner Warco. We've tracked the overdoses here in Washington County. Fortunately, the last couple months, knock on wood, our numbers are down a little bit, and we hope to have less deaths than we did last year, and that's primarily because of the work we've been doing with naloxone, and also the work of the Drug Task Force in trying to identify dealers and get them off the street. Another thing that Deputy McGreath alluded to, and I really need to emphasize this for people so that they have an understanding of what we're facing right now. This started with pills. It started with opioid medications. They're in the same class as heroin, and that's what contributed to it. That happened at the same time the black tar heroin and stronger heroin was coming up from Mexico. We went from the pills and the black tar heroin to powdered heroin. Now we're at the point where we're seeing powdered fentanyl, because it's so much cheaper than heroin, and it's also so much more deadly. That's why we're seeing less overdoses, but they can be fatal. Where that's coming from is it's coming from mainly in China. It's being acquired over the internet. What's happening in some of the areas of the country, and I'm sure Washington County will be no exception, is that you're going to see counterfeit pills being made with fentanyl and being sold on the street. People feel more comfortable taking a pill rather than injecting themselves with a drug. So that's where we're kind of headed, and that's where our law enforcement efforts are geared towards. Obviously, you know, we want our guys to be safe. They're equipped with Narcan. There's guidelines on how to handle evidence so that they don't get sick with what they encounter. One of the things that we identified early, and this is a legislative priority, is that our sentencing guidelines in Pennsylvania are not stringent enough for people that are selling this stuff in the streets and killing people and causing the cost that Representative Cook referenced. I saw some figures last week on the societal cost of the United States has been estimated anywhere from $70 billion to $150 billion for last year. That's just medical costs, costs to keep people incarcerated, costs for people to get treatment, costs for EMS to go out and respond to these scenes. So this is a significant problem. And what we need to be able to punish these guys that we've identified as dealers in poison, the heartless drug dealers. We need to be able to isolate them from society and make sure that they're not doing this anymore. So to that end, I know the Sentencing Commission, I'm supposed to testify next week on upping the guidelines for fentanyl, and I think that's a good step in the right direction. We used to have mandatories. We don't have mandatories anymore. Whether you liked mandatories or not, they were effective in helping people, encouraging them to roll on their dealer and move up the chain, the supply chain. What we've had to do and what's worked for us well here in Washington County is David Hickton, who was the United States Attorney a couple years ago, helped us get one of my assistant district attorneys, Jerry Machetta, designated as a special assistant U.S. attorney. He can bring cases in federal court and state court, depending upon what we're dealing with. When we identify somebody that's a major dealer or somebody that Deputy McReith and the task force is working on, and they've identified somebody from an overdose scene that's making a lot of people sick, what I'm able to do with Deputy District Attorney Machetta is take that person federally and really be able to impose some pretty serious sanctions on them. To date, we've taken about 20 people that way in 2 years. I've been doing this job for 20 years. I don't think we've had 20 people go federally in the 20 years or the 18 years prior to us being able to do that. So that's been a really powerful asset to us. We work very well with DEA, the Attorney General. Law enforcement is working together on this problem, and that's what it's going to take to identify dealers and get them off the street. The other side of this is people that are addicted, people with substance use disorder. Our criminal caseload went up 1,000 cases in 5 years in Washington County. We've had to add staff. We've had to devote resources to it. And a lot of these people are nonviolent offenders. They're committing retail thefts, they're going through cars, they're committing burglaries to help their habit along and to maintain their habit. We have a tradition in our criminal justice system of rehabilitating people. We don't just take them out and shoot them as they do in some other areas of the world. Our system is based on rehabilitation. So what we've done is we've had to ramp up our treatment efforts and our efforts to try to get people clean so they aren't committing crimes again. And people do get better. I mean, I've met them. People are in long-term recovery. It does happen. It takes a lot of work and it takes a lot of effort, and it takes a system that is designed to promote recovery. To that end, we formed a coalition last November involving our single county authority. Shirley Andrews is a co-chair. She's the executive director of Washington Drug and Alcohol. Part of that coalition is our warden, our jail staff, probation and parole. Law enforcement's represented in the coalition. Judge John DeSalle, who heads up our drug court, our treatment court, is there. The courts are involved with it. We have representatives from all 3 acute care hospitals in Washington County on the coalition. We have faith community members on the coalition because frequently people that have substance use disorder, one of the first people they're running into is their priest or their minister. So you have to have them have the access to the drug and treatment services so they can get them. And we work with the University of Pittsburgh Technical Assistance Center, Dr. Lynn Merigian and Dr. Pringle. And the reason we do that is we're using data. We're looking at metrics, we're looking at numbers, we're looking at where overdoses occur, who's a susceptible population when we design programs, because that's the best way to approach this. When we initially started doing this, looking at this problem about 3 years ago, we were kind of putting out fires. We're in a fire station, so that's appropriate, but we were looking and saying, well, okay, we need to get Narcan out there because people are dying, and if you can get more Narcan out there with first responders, they won't die. Well, yeah, that's a good thing. We've saved 260 or reversed 265 people since we started that in July of 2015. But we weren't working from a metric on where that should be positioned and what do you do with them when they're reversed. The legislature in 2014 passed some well-meaning legislation that was encouraging people to contact 911 and protecting people that, one, had overdosed and also had called it in, because we had people that were being dropped off or being abandoned by people that they were using with because they were afraid of criminal consequences. Well, that's kind of stopped because of the Good Samaritan legislation, but the downside of that has been the impact it's had on the first responder community, because they're responding to the same person over and over and over again. And I'm a paramedic, I'm a certified paramedic, and I talk to people that I worked with for years, and I feel their frustration. I know what they're going through. And what I try to encourage people to understand is that Narcan is not a treatment for substance use disorder. Narcan is a life-saving drug to keep somebody alive that isn't breathing or is losing their ability to breathe. Whether they get engaged in treatment or not is the problem. And when you see the same person coming back and back and back again, that's a continuum of care issue. That's not an issue with the first responders administering the Narcan. That's a person that needs to get engaged with treatment. And I talked about the coalition, and this is my opinion, and I'm going to do that disclaimer right out front. This is not the opinion of the coalition, and I don't pretend to represent them when I say this, but we need to have the ability to compel people to go into treatment when they're reversed from an overdose. Because if it's a disease process and they're not thinking clearly, waiting for them to make that determination that they need help isn't going to happen. I mean, it's illogical to think that that's going to happen. That's no different than somebody that's suicidal or has a mental health issue that's causing them to do things that could kill them. Because that's the ultimate result of this, is you're going to end up dying. Particularly when you have drugs as powerful as fentanyl that's coming into the stream that they acquire their drugs. That's what's going to happen. So one of the things, Representative Cook, I would like you to take a look at, I know Senator Costa has a bill before the General Assembly, is the mandatory commitment. The other end of the bill that I know Senator Costa has is that there's an angle there for family members to, if they identify somebody that has an issue with substance use disorder, they can petition the court to get somebody into treatment. Family members are frequently, well, they are. Family members are the first people victimized by somebody with a substance use disorder. We don't hear about it a lot because they're reluctant to press charges on their loved ones. They want to help them. And they don't, but they don't know how to get help. And this legislation would permit that to happen. One of the other things I wanted to do, Representative Cook, if I may, is let people know if you're in Washington County, the number to get help with a single county authority is 1-800-247-8379. The other thing is, if regardless of what county you reside in, the University of Pittsburgh School of Pharmacy, Peru, and the Technical Assistance Center have a very valuable website. It's overdosefreepa.org. It has all the statistics on what's going on in various counties and how to get help and the resources that are available. This is going to take all of us, and it's going to take a lot of effort, and it's not something I think people get frustrated sometimes because they hear the scope of the problem, but they don't hear what's going on to try to work for, to solve it. There are a lot of good efforts that are going on in a lot of different areas. What I tell people is you got to remember this has been going on for 20 years. It's taken us a long time to get to where we are now, and it's going to take us some time to get out of this. And that when this all started, there was no playbook. I mean, I've been in a district attorney's office for 20 years. This is by far and away the worst drug issue we've ever faced. I mean, I was a medic when we were dealing with speed in the early 90s, when we were dealing with powder cocaine. This is the third wave, and this is a serious health threat to our nation. And we're going to try things, and some of them are going to work, and we're going to try things, and if they work, we'll keep doing them, and we'll improve them, and if they don't work, we're going to do something else. But we can beat this. We need to just keep our heads up and know that we can beat this. And the example I always point to is cigarette smoking, and I can talk about that as a reformed smoker, but you know, how many people smoke nowadays? That's been prevention and education. We can do the same thing here. So, but is there anything else you wanted me to cover?
And we use the same analogies, Gene, on a lot of it. I'm old enough to remember how we dealt with mental health years ago. You kept the crazy uncle up in the closet, up in the room, and you never brought him out. The first thing that we have to realize is we do have a problem, and we all have the problem. And you know, one of the ministers that I talked to, he said, let me tell you how I determine whether it's going to be a good day or a bad day. He says, every day I take the obituaries and I see what was the youngest age of the person we lost. And if it's 55, that's a pretty good day. So a lot of this that we're doing, we don't have the answers for yet. My training tells me that you're not going to recover as an addict in 30 or 60 days. You're talking somewhere around a year, and it's a lifetime journey. So one of the parts from the last meeting, and I wish there would have been a lot more people here today. I've been to some of the programs when we do them in the high schools and the schools, and we don't have a large turnout, which kind of concerns me on one end that we're still not there yet, realizing the scope and the challenge that we have in front of us. So we've got to do our part in Harrisburg, change some of the laws, things that we did with good intent aren't doing. And I'm sure everybody at this table, and myself included here, well, let's just throw them in jail, all the way to, hey, we need to be more compassionate. So somewhere in the middle is where we're going to find our the balance there. I had a question as far as economic impact. Are you all seeing a rise in like petty crimes and smaller crimes in order to feed the addictions?
Yes, that's pretty much what my 1,000-case increase is retail thefts and crimes committed, just stuff Mark sees all the time, people breaking into cars to get change, to get money, you know, burglaries, you know, trying to acquire money out of houses, guns, trying to sell guns on the street. But one of the things you talked about, and I want to make this clear to people. Mark, what's our jail hold? About 3. I know what it's supposed to hold and what it holds. It's a pretty full place. I think it's built for about 3.5. Is that right?
It's built for 258.
Okay. Well,
we're up over 400.
Yeah, we're up over 400. The estimates I get from Pitt are that we have about 2,000, maybe 3,000 people with opioid addiction issues in Washington County, which is a county of 208,000 people. If we put them all in jail, your taxes would go up a lot. One, we don't have enough room, but it would be a very expensive proposition. The second thing is, as I mentioned earlier, a lot of these people are nonviolent. When you put them in jail and they're with people that are a little bit more criminally savvy, all you're doing is creating an opportunity for them to network and learn a few things. So jail's really not an answer. What is an answer is treatment. If you can get them into treatment, get them engaged with treatment. and get them turned around and rehabilitated. That's probably the more efficient use of the taxpayer money than, you know, housing them in jail. So anyway, I'm sorry.
Appreciate it. No, I mean, I think we're just at the very beginning of the economic impact that it's going to have locally, state, and federally. There's just a lot of associated costs with that. We had talked about beds too, Gene, as far as recovery and where we're at as far as what we have and what we need, or was that where we were at with the jails?
Well, and you probably had to get Cheryl Andrews. She can talk about that a little bit more intelligently than I can. As I understand it, there's a big need for detox beds. When somebody comes into the system, sometimes there's a wait. Cheryl and her people are really wonderful about trying to get people into a detox center as quickly as they can. Once they're detoxed, then you can talk about moving them into a more structured residential setting, and we need more of those places. We don't have enough treatment beds as is. One of the things we were running into, particularly with the jail population, and we started a program there once we identified a lot of the guys that were coming out of jail were overdosing and dying because their tolerance was down, was you know, we'd send people to treatment, and the thing that was determining how much treatment they got was their insurance. And it was just amazing how different the different insurance carriers were with how much treatment they would authorize. If you were, a lot of them were around 28 days, which for an opioid addiction, from what I understand from talking to Dr. Capretto and up at Gateway is a good start, isn't enough. Some were as few as 7 days, which is basically detox. And some were as long, if you got real lucky, 45 days, which is getting a little bit closer to what you need. So knowing that, what we did once Pitt identified this for us, what we did is we said, well, okay, if they can't get the treatment out of the jail that they need to get, then we're going to move it into the jail. So we're doing basically the behavioral treatment, the motivational interviewing. They're getting those classes in jail while they're detoxing and while they're hopefully getting a little bit clearer in how they think. When they're released from jail, and this is a voluntary program, they get a shot of it's medically assisted treatment. They get a shot called Vivitrol, which is basically a 28-day blocker they can use, but it isn't going to do them any good. We just started that in June, and we've had a number of people participate in that. And when they're on parole, they continue to get treatment and they continue to get their shots. It's just an example of how you look at the data and you say, okay, this is something we can try a little bit different. And we're tracking that to see if it works. And we're one of the, if we're not the first, we're one of the top 3 in the country that's trying this right now. There's really no data on it yet. There's no research, but it looks promising. And hopefully next year we'll have some numbers for you. But you know, you got to think a little bit outside the box on how you can do these things once you identify a problem. So.
Absolutely. I want to kind of open it up if anybody has questions from the floor, if you could go to the microphone so we can pick it up to the recording, or any questions out there? Larry. Please.
Listen to you talk and listen to you gentlemen up there, District Attorney Vitone. A lot of this is going to take money, correct? What I'm disturbed at is in Governor Wolf's budget, he proposed $40 million to fight the opiate epidemic. The Republican-led House cut that to $5 million. Is that correct? How did you vote on that, Representative Cook?
On the budget, I voted in favor of the budget.
To reduce it down to $5 million?
Yes, I did.
Is there a reason why when District Attorney Vitone said that there's money needed to fight this? $40 million that's a shot in the pocket. I mean, that's not even enough. But to cut it down to $5 million, there has to be an explanation of why. Our little towns, we need some help. And that's a statement that there's no commitment.
Well, there is, in response to that, I know that the federal government has freed up a lot of money through the CARA grant. We applied for some of that just this past year. We didn't get that round of grants, but there is more coming from the federal government, which is good. I know President Trump a couple weeks ago, and I was encouraged by what he had to say, Larry. I mean, I think he gets it. You're exactly right, though. You got to have the funding to make this happen. You got to have the commitment. Otherwise, you know, you're going to be putting into incarceration and other things. And we need to have the funding to do it. Now, we've been very fortunate thus far. Like the question I get all the time is, who's paying for the Narcan? Well, it's kind of nice because it's a little bit ironic because the drug dealers are actually paying for the Narcan right now. We use forfeiture money that we've, my first assistant, Dennis Peluso, who I know you know, he's been very good about getting the forfeiture petitions processed, and we had a little bit of money, so we used that for Narcan. So that's financed a lot of that. I think some of the $5 million you're talking about is for Narcan. They're going to pick that up. But you're exactly right. We do need more. We need more treatment money, and whether, you know, that flows from the federal government. I mean, that's a very complicated financial stream. I don't profess to understand it. Cheryl's probably the expert on it, but there needs to be a commitment and a resolve to fund treatment and make that happen.
Yeah,
so.
our police departments as well too.
Well, yeah,
they need to be better equipped to deal with this.
Sure, sure.
I had the privilege. You know, I wouldn't say it's a privilege, but I'm glad we were in the right place at the right time. Our new mayor-elect and myself, we were up on going and identifying some blighted properties one evening, and just happened to see firsthand an overdose.
Right.
And our officers at work using Narcan.
Right.
And it was an eye-opening experience.
Yeah, it is. One of the interesting things, just as an aside, since you brought it up, is we've also been tracking the response when they're given Narcan. You always hear about, I don't know whether this guy was combative or not, but
It was, yeah, female, and yes, definitely.
yeah, it actually doesn't happen as much as you would think. I mean, at least on the documentation that we're getting back at that we're tracking, about 60% of them there's no reaction. So it's you know, I think you got to remember when somebody's reversed with this stuff, they're immediately in withdrawal. Okay, so they're thinking about one thing and one thing only, you know, getting that monkey off their back and getting back to feeling okay. So they, you know, when they see police and they see fire and they want to go. That's why, you know, I was talking about we really need to have the means to compel them to go where they need to go so that they don't continue to be somebody that keeps coming back and keeps coming back. Sorry to digress,
That's all right,
but
appreciate it.
You brought it up.
We need some money. We don't need cuts.
Yeah, well, it's going to take money to do it, and you know, hopefully we'll get some of that from the federal government to help too.
My name is Rob Lasovich. I'm an EMT and a firefighter down in Charleroi. I want to kind of go along with what Larry said and what you said earlier. We need more money, but you yourself, you've ridden the trucks. You've seen taking patients for different things, and you know one hospital, you're going to get good care, the other one, you're going to get crap care.
Yeah.
All right, we could throw all the money. We could take the whole state budget, the whole $38 billion, and throw it to this epidemic. The problem with our state is you've got liberal and you've got conservative. Pennsylvania, since it was a colonial colony, has always been a moderate state. Moderate colony, not to tip too far to the left or too far to the right. It tries to maintain an even kill, not to upset anybody. The problem with this is, you had said before, the mandatory slipped away. I don't want to correct you, but this has been a 20-year process. It started with the pills and everything else. Also, you're forgetting that aspect. That needs to be included. That's what created this. I mean, we'd still have a problem. But those mandatories, all that did was basically open the floodgates.
I agree with you.
What we need, if we're going to dump money into this, you need independent bodies to oversee it and make sure things are going the way they should. Hospitals are, oh, they can tell you on paper. They can tell you to your face, yeah, we're referring these people. I've worked for 5 different agencies, EMS agencies. I've taken a patient there who wanted help, was begging for help. They discharged him 20 minutes later. Okay? There might be hospitals like, all right, here, we're putting you in contact with this person, that person. There's some that don't. The ones that are supposed to help us, their feet need to be held to the fire. You want to put more money, like Larry said? I agree with that. But there needs to be a checks and balance system, and this state is sorely, sorely missing that. I mean, 40 million, that's a drop in a bucket. But if you increase it, you damn well better increase the checks and balances and making sure. I can write you down a figure on paper. I'm lying about that. Okay? There's an old saying, believe none of what you see and half of what you hear. I like to reverse that. Believe half of what you see and none of what you hear. So my whole thing is why we're trying to figure out different ways, multifaceted ways. And I told you before, Representative Cook, it's, unless you're riding the trucks like Mr. DA did, Fatone, sorry.
That's okay.
Mr. Fatone did, you're not getting it. I can tell you what's going on. Joe Schmo down the street can tell you what's going on. Unless you're living it and you're talking to these people in just the process of their care. I had one patient, I'm going to share it real quick, overdosed 6 times. I was working up towards Pittsburgh with an EMS agency up there. The guy overdosed 6 times. We get him in there, he said to me and my partner, I guess I'll see you in 4 hours. I'm just like blowing him off, what do you mean 4 hours? He goes, oh, you know, 4 hours to fight with the doctor, an hour to be discharged AMA, an hour to go home to score my stash, and an hour for me to overdose. You'll see me in about 4 hours. It was on a 24-hour shift. Damned if he wasn't within 15 minutes. And how you say when you Narcan him, they don't come out violent. He came up swinging, saw me, goes, hey, Rob. I said, you're 15 minutes late. I mean, this is a true story.
Sure.
But, I mean, come on.
You raise a couple of really good points, and you know, you guys over 33 have been great. I mean, Shawroy's been hit hard with this too. I appreciate what you guys have been doing, you and Rob and those guys over there. And you've saved a lot of people. I mean, you've reversed a lot of people. Back to what I was saying, it's a continuum of care issue, and you're exactly right. One of the things that we've found out and we're working to reverse is having people available in the ER that understand addiction, because addiction medicine isn't something that a lot of physicians are trained in or a lot of healthcare providers are trained in. Having them in the ER so that they know, look, this is how you get somebody engaged in treatment. You get somebody hooked up with the single county authority, drug and alcohol, right from the ER while you got them. One of the things we're doing next week, and I don't know if you signed up for it or not, December 7th, they're doing a class for EMS personnel in like 4 different counties, basically to teach them on how to engage somebody and try to encourage them to get into treatment so that they get the services they need. It's called community paramedicine. It's something Dr. Dan Swayze from the Center for Emergency Medicine at Pitt's been very involved with.
As I was going through my training, I was going to be a paramedic, had some medical issues that I dropped. That's something I wanted to bring up to you.
Yeah, it's a good program.
It is a good program.
We're going to expand it.
And I know from what he was telling me, he was lecturing us, he was going to Washington County with that. I don't know the commissioner's takes on that, but it's like with your you said about the shot. These paramedics go in there, they make sure they're sticking with them. It's like a doctor.
It's not just people with addiction. It's people with any chronic health issue that are what we used to call frequent flyers with EMS. You know, if
I couldn't get my medication, I'm 5 days out, I can't get anybody to run for it, they would run and grab it.
So it's a good program for them, and Dan's had a lot of experience with it in the city of Pittsburgh, and apparently it works. So We're going to try that and see how that flies, but the training's next, what's the 7th, Thursday? Over at Cal U. I know Ryan Frazee sent out, from Public Safety, sent out a flyer on it, and anybody's welcome to attend it. It should be good stuff. I'm looking forward to seeing what they have to offer, but I appreciate what you do. Thanks, bud.
Thank you.
Thank you.
Other questions?
What's the jail stake on this, Mark? I'm going to put you on spot.
Yeah.
Personally,
Yeah. I mean, you guys are getting hit hard.
we're getting hit too hard.
Yeah, I mean, it's just,
Although Washington Drug and Alcohol does get a lot of people out and does get them into treatment.
Yeah.
A lot more in the last couple of years than before. But still, it's not so much as the same people, it's just, you know, when you knock one off, one takes its place.
yeah, there's so many. When I saw the numbers that Pitt came up with, I'm like, wow, that's just amazing that there's that many people with substance use disorder in Washington County. And that's pretty much everywhere. It's not Washington, it's not just Washington County. I mean, I don't want people to take the wrong idea away from this. This is a national problem. It's happening in a lot of different areas. We just happen to be on the forefront of it, and we're one of the areas that kind of got identified early on with the fentanyl a couple years ago and had the hot spots. And that's because we had a lot of pills in Washington County, you know, from older people and our geographic location. I think the estimate was there was, what was it? It's data report, 38 oxycodone and hydrocodone pills prescribed per person in Washington County in 2016. So that's a lot of stuff. I mean, you're counting babies and small children and everybody in that number. So when it comes down to the person that's actually getting all that stuff, that's a lot of stuff. But thanks, Mark.
Well, I would like to, excuse me, ask 2 questions. Number one, how many people in the room want their taxes raised? How many people in this room asked me to help them get money just tonight? Okay. There has to be a will, and we have a problem. There's a sign in my office above the plasma that says, attack the problem, not the person. Until we get the will and we figure out the way, I will continue to be frugal with our tax dollars. We have to prioritize. You either increase the taxes or you cut something. And I'm telling you, cutting anything in Harrisburg, it only took us how many months to get where we're at. I will stand by all my votes in Harrisburg because just like in this room, when I was out talking to people, not a single person said to raise their taxes. We have got to prioritize as a society what is the most important to us. My hat's off to these guys. They do a yeoman's job. If you've ever had the opportunity to do a ride along with a police officer at night, they deal with nocturnals. These are not people that we know out there, and they're putting it on the line every day. So we are doing a lot of things right in Washington County, and I think we're going to continue to do a lot of things right in Washington County. We've got to engage and pull together as a community. So with that, I want to again remind you, January 18th will be our next one. Tentatively right now, it's at Fallowfield Volunteer Department. We have an awful lot of materials on the table over here we would encourage you to pick up. There's some from the Sheriff's Department. And again, reach out. That's what we're here for. The takeaway that I had from the last meeting, if this saves or helps one person, this all was worth it tonight. So on that, again, thank you very much for the opportunity to serve and represent you in Harrisburg. And thank you all for being here tonight.
Thanks, bud.